Hey everyone. So for this edition of our CHP Spotlight Interview Series today, I am really excited because we have Dr. Ryan Murray here with us. Dr. Murray works at Medstar Health, Medstar Orthopedics, and he specializes in pediatric orthopedics and sports medicine. I know Dr. Murray and I were just chatting before we started recording here about even some mutually shared patients. And I know some of these stories would be really of interest to some of you out there, and so would his expertise. And again, just to give you some insight, his background includes just some of the following. This obviously is not all of it, but a lot of the ligamentous injuries we often hear about, ACLs, and even how it influences that in the youth population, patellar instability, cartilage and meniscus issues in the knee, shoulder instability and dislocations, and obviously the gambit of sports-related injuries. So with that being said, Dr. Murray, really appreciate you joining us today.
Yeah, thanks so much for having me, Zach. This is great. It's been great getting to know you and working with your group, taking care of patients. So thanks for having me.
Awesome. Well, I appreciate that. And you know, I'd love for everybody watching this here today to just to get a little bit of an idea of just, you know, the types of, I mentioned some of the conditions that you treat. I'm sure, hopefully I didn't sort of beat you to the punch there, but you know, a little more about just like the types of patients that you kind of work with, maybe the diagnoses, but also maybe just, you know, ages, types of interest, things like that.
Yeah, so my training was in sports medicine in Pittsburgh, and then I also did a pediatric orthopedic fellowship here in DC. And so I see a breadth of patients in terms of their ages. I take care of, younger patients with, fractures and things like that. And I take care of older patients with sports related injuries, rotator cuff tears and things like that. But really the niche area, or the subspecialty area of my practice is really, young pediatric, adolescent and young adult athletes. And so, my typical kind of bulk of my patients range from anywhere between 10, 12, even younger year old athletes, into folks in their, early 40s, 50-year-old athletes, and I think older age patients is a moving target, since, basically anyone older than me is old. And as I get older, that number will keep going up. But really anyone who's living an active life and playing sports is, susceptible to the injuries and problems that, I treat. I do a lot of knee and shoulder, stuff, if you will, from, patellofemoral pain, instability, ACL tears, and the same with shoulder, from shoulder instability, rotator cuff problems, and things like that. Sort of the pre-arthritic conditions of the knee, and try and preserve people's native joints and functions so they can keep doing the stuff they want to do.
Love that. I really appreciate that insight. And we were talking about actually before this, for everybody here, I told one of our patients to go see Dr. Murray, because even though this person is an adult, like a lot of us out there, we want to be active. We want to still be able to live that athletic lifestyle, whether it be going to the gym, playing in, your adult basketball league, play golf, tennis, whatever the case is. And so it's really helpful to be able to see somebody who knows how to treat people that function at the highest level, because that really demands the most stress. So if we can handle that, then we're really going to have some good context for things. So with that being said, I'd love to hear about the youth athletes, because what's really unique, and one of the reasons I was really excited to talk to you, is that it's always a struggle for us to find the right physician to refer to for our patients, especially for like the youth population. So you mentioned as young as like 12 or 10. Amongst them, like what is the most common, or what are some of the most common or unique injuries that you tend to see for kids that age?
Yeah, and I think that's a problem and a need that I my practice tries to fill, because there are pediatric orthopedic surgeons who take care of babies and small kids and all different kinds of a huge wide range of problems, hip, spine, all kinds of stuff. And then there are adult sports doctors who take care of, a typical adult patients, and in this middle ground of patient, I think when I was kind of figuring out what to do with my life, I said, these children or adolescents are kids, and there's certain things you got to think about and know about, and in my field, that's my job. But the reality is, they need to be treated like athletes. And athletes, I'm not talking about people who play on Sunday. I'm just talking about people who want to live an active lifestyle, be competitive and push themselves. Those folks have a different mentality than, someone who spends a lot of time more sedentary or doing other things. And so you got to treat the kids like athletes too. And that doesn't mean, push them to do things they shouldn't do or push them too hard, but you got to talk to them with the context of the fact that, listen, I know this is something important to you, and I know this is something that brings you joy, and it's a social experience and all these things, but, for this reason or another, you need to do this treatment or that, whether it's rehabilitation, operative treatment, or somewhere in between. And I would say the most common things I see in those younger athletes fall into two categories. One is sort of the chronic, lingering problem, and the other is an acute problem. But the chronic problems, kids are people like to say kids are not just small adults. And while that's true, their body still functions the same way. They just have growth centers that can become irritated and overused. So much like I would get tendonitis in my, rotator cuff, or tendonitis in my patellar tendon, those tendons in a kid attached to a growth center, and that can become irritated and sensitive. And it just needs a little bit of rehab after a period of rest to get better. And a lot of these things, the kids eventually outgrow when they're done growing, but it needs a little bit of kind of treatment rather than, I think a lot of kids go to, a primary care doctor or someone else and they say, oh yeah, just don't do that. But telling a kid don't do that is not really a solution, because they're either A, going to do it and it's still going to hurt, or B, they're going to be miserable. They can't do what they want to do. So it's a partnership in getting them better. And then the acute injuries are not dissimilar from adults, with the exception of the fact that kids can have some variations, whether, it's a bony avulsion of their ACL or tibial spine or a tibial tubercle fracture or something. It's a variation on an adult condition that requires a little bit different treatment. But acute injuries still unfortunately do happen, especially now with the volume of sports kids are playing at high levels.
Yeah, gotcha. I appreciate you saying that. And you actually led into one of the next things I was thinking about, which, it's interesting. I feel like because we see a lot of youth athletes as well. And I feel like we're seeing, and things always evolve, but I feel like we're seeing some changes in terms of maybe the frequency of certain types of injuries in the youth population, and almost certain types of injuries skew younger and younger. And, this is a little anecdotal on my end, but, especially the one that pops into my mind is like ACL tears. And so I know you obviously deal with that a lot, very common injury. And so obviously you see a lot of those young kids with it. I'm curious, have you noticed like that trend also? And if you have or have not, is there, what risk factors do you see for these kids or that put them at risk for this? And is there anything like you wish they or the parents knew?
Yeah, I mean, in my practice, I mean, ACL injuries are among the surgeries I do kind of far and away the most frequent one I do. I probably do half dozen or 10 a month, and it's pretty common injury and I'm talking a pediatric or kids under 18. And so, and it's borne out in the literature too that the ACL injuries kind of are on the rise. And I think a lot of that has to do with, the participation in competitive sports, right? Your risk of sustaining any injury is proportionate to the amount of time you put yourself at risk for sustaining that injury, right? I'm much less likely to tear my ACL than a 14-year-old because, like, I don't play sports 5 times a week, you know what I mean, at a high level. And so ACL injuries are common just from that exposure, or those exposures. And there are, several risk factors for ACL injuries, whether it's muscular imbalance, female gender, unfortunately, some ligamentous laxity issues. And among that, the sports people play, contact sports and cutting and pivoting sports being risk factors, soccer, football, lacrosse, things like that. One thing that I've always been interested in, and I think is actually really valuable, is ACL prevention, ACL tear prevention. And there's a blog post that I wrote through the Medstar website, and there's but a lot of that hinges on the FIFA 11 strategy, which is, neuromuscular retraining, particularly for soccer players, is what it's designed for, but anyone can do it. And I've seen that. I mean, I see a lot of coaches and their kids, and they're all doing it now in this community. And I think that kind of speaks to the fact that people in the Metro DC area are pretty well educated and pretty on top of it, and don't want their kid to have an ACL tear, right? So they tell the coach or the league we should be doing this, and it's a way of warming up and training that has been shown, in literature to reduce the risk of ACL tear in high risk people who are your soccer players, they're your young athletes. And so I think, although you can't always prevent an ACL tear, it's going to happen. I do think being cognizant of the fact in the community that this injury is relatively common, and doing some training and taking an active approach to sort of prevent it can help. And people have different opinions on single sport specialization, year-round play, and things like that. My opinions on that are frankly less strong. I mean, I think if you look at high-level athletes, whether it's Patrick Mahomes or pick your favorite professional athlete, a lot of them could have gone professional in multiple different sports, right? And so I think being a good athlete is being a good athlete. But I think if you're really good at something, as long as you're cognizant of the fact that you got to cross train, you have to rest, you have to recover, and those things, and that's what working with guys like you is really important for. They can say I know you know how to kick a soccer ball, but let's look at your core strength, let's look at your your flexibility and things like that, and that's how you prevent injury, is being cognizant of your weaknesses. So
Yeah, 100%.
And that's where I think educating parents and things like that is super helpful to pediatric athletes.
I love that. And one thing I really appreciate too, Dr. Murray, about the way you worded that was you're kind of looking at it with with nuance. I think a lot of the times it's, very easy especially in the medical health fitness space, very easy to go black and white with things. But we're all living in a world of gray. It's kind of like the old adage of that's why they say, we practice medicine, where it's forever practice, never mastering, because, there's always so many factors, our patients have heard us say this a million times, especially with an athlete, that influence why anything's occurring. So to say there's always this one black and white answer is usually a little short-sighted. So I love that you said that, because you're right. I think sports specialization, just to highlight that, is definitely a big topic.
Yeah.
And being able to sort of see the middle ground with that is really helpful and really helpful for me to hear as well. And now we've gone over some lower body injuries. Now you also see a good amount of shoulder stuff, as you mentioned.
Yeah.
So similar to the previous question about ACLs, with, I guess, both youth athletes and adults, you mentioned obviously a lot of rotator cuff issues and things like that, and the injuries you see. What do you foresee as some of the main risk factors for that, and anything kids can do or adults to maybe mitigate that risk? Because I find that sometimes less commonly talked about.
Yeah, shoulders is sometimes overlooked in the youth athlete. And again, shoulder injuries fall into that kind of two categories of, chronic and acute. And the acute injuries of the shoulder really in kids boil down to instability or dislocation, which I think has been at a relatively flat or standard rate over time. There are some reasons for that. I think there's some variability geographically in football participation, and football is really where you get your traumatic instability in the youth athlete, to be honest with you. And that's really, and then AC joint injuries, which are obviously still pretty frequent in your contact athletes as hockey players and things like that. And the risk of those is relatively stable. What I see more frequently, or with increasing frequency, and it's seasonal, is overuse type injuries of the shoulder, particularly in the young baseball player, and softball players for that matter. Throwing sports are hard on the shoulder, right? No matter how old you are. But again, going back to what I said earlier about kids having, vulnerable growth centers where their tendons insert, these kids come in and they start losing their velocity, they lose their control. And you touch the top of their shoulder, their proximal humerus, and right at the growth center, it hurts. And that's a pretty easy diagnosis to make. But it's a hard condition to treat, because how do you tell someone the treatment for what you love to do is to not do it for a period of time? And I had this 3-phase approach. I talked to him, I said, listen, we got to rest you for a period of time and get your symptoms better. Then we got to rehab you for a period of time and get yourself stronger. And then we got to get you on a throwing protocol and get you back to sport. And that can take anywhere from 6 weeks to, 4 months, depending on the problem. And there's not a lot of ways around it. And you see the same thing in the collegiate baseball players I take care of at Georgetown, or even older folks who play pickup sports. It's there's a certain threshold your body can handle in terms of injury and inflammation and discomfort. But the best ways I found to mitigate this problem with the shoulder is number one, even if you don't have a shoulder problem, if you're throwing something for fun or for competition, you should be doing a relatively standard protocol of rotator cuff and periscapular strengthening exercises. It just is a part of life, like brushing your teeth, because that keeps your mechanics strong. And then I find all these throwers have tight posterior, and so internal rotation, stretching exercises, sleeper stretch, and the like, keep these folks out of trouble. And I find that what happens is, right around this time of year, I see a lot of baseball players who are gearing up for baseball season. They haven't thrown in 3 months, and their shoulders pretty stiff, and their mechanics are a little off. And I'm like, listen, this is actually, the best time to have this problem, right? Because baseball season hasn't started, but we got to get you rehabbed up before it does, because that's how you prevent this kind of overuse injury.
That's super helpful to hear. I mean, we see a ton of baseball players, so I already know some people I'm going to be studying this too. And yeah, I think baseball's tough. Like it's one of those things, because it's I think there's a great PT out there. From my alma mater, Northeastern in Boston, who used to be the PT for the Red Sox, and I know I've heard him say a million times, throwing is kind of an unnatural motion. So it requires a lot of prerequisites to be able to do it effectively without having to compensate. And not that you can't do it, of course you can. It's a professional sport, but there's some it's really easy to compensate, and when we do, it's really easy to almost arm the ball, for lack of a way of describing it, when you're not doing something right elsewhere. And that's where you can beat up your shoulder, elbow, all those kinds of things. So really love sort of that just in-depth explanation there. And then finally, if I'm an athlete watching this, most likely probably a parent, how do I know, unless obviously if it's a real acute injury, I just broke something or tore something, it's very obvious. But I guess besides that, how maybe something's been bothering me for a little bit of time, I'm suspicious maybe something happened, but I'm not sure. How should I know whether or not I need to come see you?
That's a good question. I see this time and again. Really, the parents know their kid the best. I'm a parent. Hopefully I know my kid better than the average person, but I certainly perceive that myself. But I see parents who come and they say, "Hey, listen, something's not right. They're walking funny. They tell me they're fine." And every kid, right, wants to be a kid. They want to play. They want to be fine, right? They don't want to have a problem, more so than adults probably. And they're not really capable sometimes of expressing how things are feeling. And so I really think when a parent feels like something's not right, they watch their little league game and they're like, he's throwing all over the place, or every time he swings, he kind of grimaces, or they're playing soccer and they're like, yeah, they're not running as fast as they used to, or they're not cutting to the left, or and then they want to ice their knee or ask me for Advil. I mean, those things are things, and the pediatricians are great, at first step sometimes, you a little bit more accessible, but much like for acute injuries, same with kind of more lingering things. I mean, we have an ability to get people in pretty quickly to see us, and a lot of different locations. So in terms of the ease and efficiency of getting seen and having someone tell you, this isn't anything to worry about, you'll be okay, or this is something we need to investigate more. I think when a parent's kind of intuition kicks in and says, this is something we should look at, or I'm a little worried about, I always say err on the side of getting it checked out. And I always tell patients, sometimes patients see me and there's not a lot wrong, and I say there's no wasting my time here, right? This is your health or your kid's health, and you want to know, and my job is to give you answers, or if I don't have the answer, find it out. And that's why I do what I do. It's not so I can only see ACL tears and do ACL surgery. I mean, sports medicine is caring for kind of everything, and that encompasses a lot more than just, physical injury or psychological stuff, rehab, all kinds of stuff you got to deal with to get people better. And that's kind of the all encompassing part of sports medicine that works for me, and I like it. Doesn't work for every orthopedic surgeon, but.
Yeah, well, I appreciate you saying that. And yeah, I will say from the sports medicine side, right? I think you're trained to be able to sort of see it all. And even if like, okay, you're not going to do the surgery on a specific area, you're certainly can figure out what's going on and then where to triage to. So I'll say for anybody out there watching, because I know a question I get in PT a lot is they're just like, I don't know who to see for this.
Mhm.
And like somebody like Dr. Murray is great. If you're just like, I don't know, hey, go make an appointment, because at the very least, even if it's not specifically like a joint or an area that he might do that Dr. Murray might do a surgery on, at least he'll get the ball rolling, get you to the right person. And so that's why, like, we're, again, with our new McLean facility, we are so pumped to have Dr. Murray close by. And I know, Dr. Murray, you treat at a few different locations, is that right?
Yeah, so I actually am now at 5 locations. Georgetown is sort of the home base, McLean, Chevy Chase, Tenleytown, DC, and we have a new office in Gaithersburg, Maryland. So I'm there at different times of the week, but they're all those places on a weekly basis. And our office is really good about getting people in to see me or any of my partners, but just I take care of most of the pediatric stuff. So.
God, I appreciate you saying that. So yes, for any of the Bethesda audience we have or the McLean audience, don't have to go too far. And then for anybody watching this today, before we sign off, I'm going to put a link to Dr. Murray's contact information, the website, all that great stuff, phone number below the video, so you don't have to look far to find him. But with that being said, Dr. Murray, I really appreciate you joining us today. I know I got a lot out of it, so I bet anybody watching this did as well.
Yeah, I really appreciate you having me, Zach, and thanks for helping take care of all the people around here that need some help.
I appreciate that. Thank you.